Welcome to Candid Minds with Dr. T. I'm Dr. Tamir Aldad, addiction psychiatrist and CEO of Mindful Care, the first ever psychiatric urgent care committed to providing affordable and accessible mental health care. Hello, and thank you for joining us. Welcome back to another episode of Candid Minds with Dr. T and friends. I have Nick, our co-host, with us here today. We're going to be answering some of your questions. Nick, how's it going?
Good, very good. I'm so glad to be back sitting here with you. I've come back from Australia about a week ago and freezing my ass off here. But it's great to be back, and I love being able to sit down and have these conversations. And I've really got, there's been so many different messages coming in from listeners, and especially on this topic we're talking about today with addiction. It's such a broad topic. So, it's going to be really interesting to be able to get your take on some more, specific definitions and understandings of it. So I might just jump in and ask you. I've got on my phone a few questions that listeners have sent.
Absolutely. Just to give some more context, we'll be discussing addiction and substance use disorder today. As an addiction psychiatrist, happy to give you my perspective on some common questions. I did take a look at them earlier and took some notes. I think it's important to realize that everyone navigates substance use disorder differently. It impacts the individual, but also their friends and family. And it makes sense that it could feel very lonely sometimes. And people having questions is a part of the process, both no matter where you are, if you are considering sobriety, in rehab, living a life of sobriety, it doesn't matter. It's difficult and challenging. I definitely salute all those going through the process. And if some of our answers could be helpful to people navigating that, happy to be of help.
Absolutely. And I think, it's such a good point that you're saying there with, my experience has really been through, sharing my story and being in that advocacy space and just seeing how powerful it can be to be able to hear about what other people are going through, because we really do, shame ourselves, and we don't often have a blueprint of, how do you go about these things. So it's a big area.
Absolutely.
It's a big one.
Let's
jump in.
What's your first question you got for me?
Okay, so here I've got, the first one that's come in is, are you able to define addiction from a medical perspective? There's so many different, ways that addiction's talked about. From a medical perspective, how do you define it? What would be the specifics?
So I think getting into the neurology associated with addiction could make it unnecessarily confusing for an individual trying to assess if someone in their life might be having a substance use disorder or an addictive behavior. So at the top of the list, it's important to recognize and acknowledge that it is a chronic medical condition. It's very complicated. Right? So thinking of it as a decision or a choice is very dangerous. And I encourage people to first acknowledge the fact that it is a medical condition. Now, what we see is these individuals with a substance use disorder or any sort of addiction develop compulsive behaviors, right? Where they're constantly looking for that stimulus or that reward. And eventually it gets to the point where the consequences don't matter. So it impacts their ability to make decisions, right? So you're seeing this engagement in ongoing behavior or substance use that no matter what negative consequences happen, the behavior continues and sometimes even becomes more frequent. And two big things that we notice there, right? There's a psychological component, a physiological component, but two things that are really characteristic of it is a tolerance level, meaning no matter when you're using it, the reaction that you get or the response that you get to that behavior or to that use isn't the same at the same level. So you need to do it more or you need to use more to get the same response. And tolerance is a sign that there is an addiction happening. And the second one is the opposite, where if you don't engage in the behavior or you don't engage in the use, you feel withdrawal symptoms. That could be actual physiological withdrawal, where it could be very dangerous, such as the use of benzos or alcohol. But there could also be psychological withdrawal, such as with gambling or pornography or gaming, right? Where there isn't a real physiological withdrawal, but you're still feeling the need to use it and it's impacting you. So I would say at a very high level, looking at those characteristics and assessing if you check off a lot of those boxes, that's the first step to establishing that there is some sort of addiction here.
Yeah, and just a second part to that from me. Is there a broad sort of misconception that certain things are, addictive behaviors and certain things aren't? We typically obviously have drugs, alcohol, that side of it. But, we might be addicted to work. We might be addicted to, who knows, so many different things. Is it the kind of thing where it can really be any, it can come out in any behavior through different areas, not just the typical ones?
Absolutely. I see it. It really depends on the impact on the individual, right? And where you see it the most is when they're ignoring negative consequences, because even if they want to stop, they can't, right? And that's when you realize that it's a problem, and that's when an intervention is necessary. So there are your regular ones, right? Drugs and alcohol being your top two, but you really need to assess if the person has some sort of behavior that they find very satisfying, that they constantly need more of, to the point where it isn't that satisfying if they don't do even more than they did the last week or the last month, and it's starting to impact other areas of life. So work, family, friends, right? And then you start seeing poor decision-making around that as well, with negative consequences as a result of that.
Yeah, interesting. That's a really good, a really important thing for, I think, anyone listening to really take on board, and for us to understand, for people we might know, to be able to observe their behavior and help other people. So
yeah, absolutely.
Yeah, I'm gonna go back to the next question. So I've got Lucy from California here has put a question in. As an addiction psychiatrist, you've seen firsthand how mental health and substance use disorders intersect. What misconceptions do you think people still have about addiction? And we've talked there about part of it, where what areas are addiction, what aren't? What other misconceptions are there?
There are many, and I could tell you, as an addiction psychiatrist, it's frustrating to navigate them, because it's been years of these myths being passed on from generation to generation. I would say the number one is that addiction or substance use is a choice, and those that deal with substance use disorder have a lack of willpower. And that's incredibly frustrating to hear, particularly with patients that are incredibly motivated and incredibly invested in their recovery and their treatment. It's disheartening. Now, there are individuals that aren't ready yet to engage in recovery, but that has nothing to do with willpower, right? That has to do with insight, that has to do with their thought process, that has to do, there's other components that get them to the point where they're not ready. But the idea that they're choosing to be addicted is a myth, and it also is very damaging. So that is one. The other is that it's independent of a mental health disorder, right? That you should treat your mental health and you should treat your addiction, but there isn't an overlap, is another one that we hear. And the exact opposite is true. There is a huge overlap. Many patients with substance use disorder, or individuals with substance use disorder, are in fact self-medicating for an underlying mental health condition. So you have people dealing with depression that are trying to use uppers. You have people who have ADHD trying to use downers, all in an attempt to be productive and actually feel normal. Right? More often than not, we see individuals who tell you their path and their journey to substance use disorder was trying to regulate themselves, and their intentions were benign. It's unusual to hear somebody saying, I wanted to live a life of substance use disorder where I lose my family and my kids and everything crumbles so I could use all day. That isn't the story. When you get to know them better, you realize that they were trying to optimize, and it got the best out of them.
Yeah.
So that's another one. The third one, I can go on and on with this question because there's so many.
It's a big topic.
It is a very big topic. Another one is when I see friends and family hate on somebody who relapses during sobriety. That one is incredibly frustrating, particularly because relapse is a part of the journey. And supporting somebody through a relapse is very therapeutic and very important. So when we see people say, oh, he relapsed, he's failed at his ability to recover, particularly early on in sobriety, right? So someone finished a 28-day program, they go home, they go to a holiday party, they use their drug of choice or their substance of choice. Well, that means the program failed. That's not true. That's not true. They weren't set up for success by going to that, seeing that, being triggered, not being able to identify cravings, not having maybe the skills at the moment. But many recover and quite quickly get back on track. So appreciating that relapse doesn't mean that you failed is another myth that really needs to be eliminated when people think about substance use disorder and addictions in general.
I love that point, because I mean that's so important for people to remind themselves, because you can so easily, you can make some progress, relapse, and then shame yourself and tell yourself all these different stories, and it just leads to self-destruction. And I think from my own experience, really trying to think my way out of things only ever made the problem worse. It was when you accept that there actually is a problem here and try and take the measures and steps to work through it, and then give yourself grace if you do go backwards and make a step back. And for me, it was really alcohol abuse. I was drinking to numb myself out through the early part of my 20s, and getting in life-threatening situations. And looking back, I had mental health issues. I had undiagnosed ADHD. I had a whole lot of self-esteem issues, and I didn't have anyone around me who understood what was going on, and it just was seen as negative behavior, and I was shaming myself, and it just went on and on until eventually I was able to start getting to the bottom of it and really getting the measures in place, getting the right people around me. And it just took such a journey to get there. It's why I'm so passionate about trying to talk about these kind of topics, because if I had the information and resource earlier in my life, I could have avoided so many different mistakes that were made. And a lot of people go through a similar thing as me and maybe don't come out of that self-destructive path. So we need to understand what you're talking about here and know where to go and how to get the support that we need. So,
how did you realize in your case it was an issue?
It was just, I think looking back, it was the only time I remember there was a sweet spot of probably like 6 or 7 beers where I would have this moment where it was the only time that life ever made sense. It was like my brain slowed down enough that I could see everything so clearly. And it was literally like putting glasses on. And then I'd keep drinking, and then I'd get, blackout drunk and whatever. But it was that moment. And I guess on reflection, when I was starting to work through it and looking at that, I realized something's not right. Like, there's got to be more than this. And Australia, we'll talk more about this, but I think it's just so incredible what you're doing, because we have a big problem in terms of finding the right care in Australia, especially psychiatric care. I've got a friend right now who's trying to see a psychiatrist, and he's been waiting for over a year to get an appointment in Australia. It's a major issue.
Wow.
And I was frustrated because I had a problem. I went and saw all these psychologists, some psychiatrists. No one really was able to identify what was actually going on. So it wasn't actually until I met my partner, who was she's got ADHD. She said, "Look, you're crazy. You're probably, if you don't have ADHD, I'll be shocked, because you probably got it worse than most people." She saw all the behavior patterns. I went and got diagnosed for it and got medicated, and it just changed everything. I quit alcohol, and by that point, it wasn't as much of a problem as a self-destructive behavior, but it was still affecting every aspect of my life. I was not able to focus on one thing. I would have just intrusive thoughts. I would be constantly changing my perspective on everything. It was torture. I'd be worrying about crazy things. And it really did change everything. So having her was just, the best thing that could have happened. I feel very fortunate, but it really still, makes me just want to talk more about this stuff, because it makes me realize how many people are there out there that are going through that and are just not getting the help they need. It's crazy.
For sure. And your journey actually is the classic journey.
Yeah.
It's the self-medicating journey that identified there's an issue or felt there was an issue, tried to deal with it, got out of control, had an epiphany, wanted to get it back under control, right? That's a very classic story that if people hear that, it could really empower them. If they're able to identify with that and it resonates with them, that's huge. And I hope we could do that for people.
Absolutely, absolutely. So yeah, it's so important. So I'm going to jump to the next question here. We've got Tom from Boston has sent in one that I'm going to read out to you. So, uh, what are some early warning signs that someone might be developing addiction? So if we if we know someone, we're seeing sort of behaviors. What do we look out for?
Yeah, so it's interesting if you're the individual or you're outside looking in. If you're the individual, two things I would look at is if you're developing a tolerance,
Mm,
meaning you constantly need more and more to get the same effect. If you have withdrawal, so if you're not using or you're not engaging, you feel a certain way, and you develop symptoms that would be relieved by engaging or by using. Now, if you're looking from the outside in, it's difficult to appreciate tolerance and withdrawal. But what you can appreciate is, like you said, where you're neglecting responsibilities, your changes in mood, changes in sleep patterns, changes in appetite.
mm,
That's when you start seeing that the person is engaging in some sort of behavior or substance use repeatedly, and now there's behavioral changes and mood changes associated with the use. That's a pattern for concern, right?
mm.
And that should be explored further. And I think ultimately its impact on someone's individual life, right? That if someone is starting to be unable to function, uh, now, you could challenge me and say, well, what if you're a there's that term high functioning alcoholic, which I have a lot of issues with,
Yeah,
um, because I think there's just a lot buried there, and that's probably a different conversation to unpack, and my thoughts on that. But for the individual who traditionally uses, and then it starts really affecting their ability to be productive across all aspects of life, that's already a quite severe situation requiring intervention. But early on, to answer the listener's question, it's starting to see subtle changes in their ability to function, neglecting responsibilities, sleep issues, appetite issues, mood swings, mood lability, things like that.
yeah, and like you're saying there really are so many areas to delve in with this. It's such a huge topic, and I mean another thing that I've seen happen, and I've had happen with myself, is you get on top of the core addictive problem, and then it just comes out through other behaviors. It might be, for me, it became, okay, I'm going to numb myself out at the end of the day as a reward. I'm going to buy a whole lot of junk food, watch movies on Netflix, and do that till 2 in the morning. And then that affects the next day. And it becomes the new problem that you've got to now change. And that's what I think a lot of people find really difficult. You get on top of it, but then you're looking for that escape somewhere else.
100%. And it's not sustainable.
No.
Right? It's quick fixes that constantly aren't satisfying, so you're insatiable effectively, and it repeats itself. And when it repeats itself, it actually gets worse, right? And that's
Yeah.
that tolerance that you constantly need more. The withdrawal gets worse. The use becomes more frequent or higher amounts, right? So
Yeah.
you're constantly seeing that the pattern just becomes more and more aggressive.
Yeah, absolutely. So another question here. This is from Tom in Boston. He said, "Why do some people develop an addiction while others don't, even if they're using the same substance? How does that happen? Is it something you're born with, that predisposition to it, or how come?"
Yeah, these questions require, each one could be its own podcast episode.
That's what I'm thinking.
Yeah. So I would say at a very high level, the two biggest things to consider is that there is genetic predisposition, and you could see that through family history, right? Very frequently, individuals will tell you that my grandfather had alcohol use disorder, my father had alcohol use disorder. I always promised myself I wouldn't, and here I am now. I have alcohol use disorder.
Yeah.
Right. So that tells you that there's a genetic component to it as well. But there's also environmental factors, right? So two individuals with the same genetic predisposition with different environmental triggers may or may not develop it, right? So it really has to be that right recipe where the environment encourages it, right? For lack of a better word, or sets you up to develop a substance use disorder, and you're genetically predisposed to likely develop a substance use disorder. So at a very high level, I would say that's what we see. To explore the genetic component, family history is what we look at first and foremost, to see if this is something that is unique to you or isn't. And then different environmental factors and stressors change in individuals' need to use. Individuals in high stress environments, individuals with inappropriate response to trauma, lack of skills in response to trauma, grief issues, right? There's these triggers that get an individual to use. And then if they have that genetic predisposition, sets them up for an addiction or a substance use disorder.
Yeah, there's so many levels. So many things are coming into my head that I want to personally ask you about this. But I think, like you said, we'll probably have to do another podcast on it at some point.
Sure.
So I've got one more question here. How do you view emerging addictions, like cell phone use, TikTok, pornography addiction? Are these new forms of addiction? Are they something that we should be concerned about? I know for me, I run so much of my business through social media, and that's become a new thing where I had to find that balance of how do I not just waste so much time scrolling through and looking at all this stuff that's just not productive for me. It's so addictive, and it terrifies me seeing, in schools, these kids with these phones at such a young age. Yeah, can you talk a bit about that?
Yeah, absolutely. I think it's incredibly real. Doom scrolling for children is an issue. Getting that dopamine hit every time you scroll up, you'll notice children are watching a video for 3 seconds and they scroll up again and scroll up again and scroll up again. It is very difficult to compete with that. Even if you take a child and put them on a soccer field or a basketball court, you won't get that same level of satisfaction that you'll get from constantly scrolling up, right? So it makes it very difficult to let a child go play outside, or even if you give child blocks, it's considered very boring because of that really significant dopamine spike they keep getting when they're scrolling. So I would say we need to be very cautious in monitoring how much exposure we give our children to screen time. And I mean, that's not novel. You're hearing that every other mental health professional is saying this. But through the lens of addiction, to make my answer a little more unique, I would say assessing the actual downstream consequences of use isn't always done and should be done. Meaning, are we seeing that this individual needs to use more to get the same effect? If they're not using, if it's a child, are they having temper tantrums? If it's an adult, are we seeing changes in behavior if they don't get to use? Right? If you and you could see this in yourself too. If you put your phone away for an hour, how do you feel? Right? What's the level of anxiety if you can't check your phone for an hour?
Exactly. It's pretty high.
Yeah, I could tell you. I mean, real talk, when we got to this studio and they told me there's no service here, I got anxiety. And I asked for the Wi-Fi password because I was like,
exactly,
I can't imagine being here for a couple of hours and what if the world ends? I would like to know that, right?
Yeah.
So even on myself, I could tell you that there is a reaction. If you know there's a reaction, or you do a test and there's a reaction, that's concerning and should be explored. So yes, do I think there's that there individuals could be developing new types of addiction, new forms of addiction? Absolutely. But I would say it's important to continue assessing it through the lens that we assess all use disorders, whether it's behavioral or substance, to see if there is an actual issue there that should be addressed.
Yeah, and with what you're saying there, it really highlights that almost all of us on some level are addicted to something, and it's a scary topic when you dive further into it, but it's something we need to talk about, and just drastic action needs to be taken, in my view.
Yeah, we even see it with exercise. We see it with food and eating disorders. We see it with tons of behaviors beyond just drugs and alcohol. And you got to keep asking yourself, are there negative consequences on your life? What happens if you're not using or engaging in that behavior? Do you have to engage in the behavior more or use more to get the same level of satisfaction, to really assess if this is an issue?
Yeah, absolutely. So I've got one final question here. This is from Liam in New York. He said, how can family and friends best support someone who's struggling with addiction without enabling them?
It's tough. First of all, being very educated on substance use disorder and addiction as a whole is really important. And appreciating that it takes people, places, and things to trigger an individual who's living a life of sobriety. So if someone comes back from a detox and a rehab, creating an environment for them to be successful is really important. Respecting them if they can't come to an event, don't want to come to an event, don't want to hang out with individuals that they might find triggering, don't want to go to places where they feel they might relapse. So really being encouraging and supportive. But particularly interesting in the question is enabling, and enabling comes with boundary setting. So what happens is a lot of times people provide financial support that could later be used for essentially fund the use disorder. They could help the individual create excuses for missing work or not taking care of their responsibilities, right? So the boundaries that need to be set there are really, really important. And at the end of the day, will help the individual, whether they appreciate it then or not, long term will help that individual be successful. So with those that find themselves perhaps enabling, assessing where exactly they feel they're being taken advantage of and setting clear boundaries and using assertive communication skills to relay that will be a game changer for their dynamic, their own mental health, and the mental health of the individual that they're engaging with.
Yeah, and if I reflect back on my own experience with that, going back again to my girlfriend, it wasn't until I had that level of support and understanding from someone who was that close in my life that I realized how much I lacked in it throughout my whole life. And my parents did their best. They didn't understand this stuff. They were not able to talk through and, see what the behavior meant. So that was sort of swept under the rug. The friends I had around me were enabling it. I was, on TV shows in Australia, getting invited to parties. Alcohol was there. Friends would come with me. They would find it funny to see me getting so drunk and fun and be encouraging that behavior.
Yeah.
And I felt like something was wrong, but I wasn't holding them accountable as well. And I just fell into having that role within the friendship. And, it makes me kind of sad to think back on it, of just so much could have been different if I had the kind of people in my life that I have now that would just not have tolerated, that behavior.
Yep.
Because they would have known that's not the best thing for me. But it also came from the fact that I didn't have the understanding or self-respect to be able to find those people that would hold me accountable, and probably didn't want to be held accountable at that point. So yeah, it's just so important that we think about that and try and find people that, like you said, I think you said it so well, that it might not be what we want to hear, but it's what we need. Find those people. They're the people who really care about you.
Yeah, for sure. I think, I had a case where an individual almost lost their job, and his mom would constantly create these stories to tell his boss that he's in the hospital and he's sick and all this to keep his job. And that was actually doing him a disservice.
Yeah.
Right? The real thing that you should have done is let him lose his job. This is his journey, and you're actually interfering with his journey. And you're delaying the work I'm doing by doing this, right? Had he lost his job, he would have come to detox sooner, rehab sooner, lived sobriety sooner. You're delaying the work I'm doing by enabling, where in fact you should let the person experience it, experience the consequences. That's a part of the process, and then we take it from there.
That's a whole nother podcast as well, because, that's the thing in the world now where it's, people are getting, they're sheltered and they're having all of these different fallbacks. And unless we're held accountable, I know for me, again, I was sheltered. It wasn't till I went and just fell on my face and removed all support systems, and it was terrifying, but huge change came out of that, and it wouldn't have come. And you see it so much now with, a lot of sort of the woke movement as well, where it's gone, I believe, too far, where now it's like, okay, if anyone's got the slightest concern,
you're going to get canceled.
Yeah. And let's not, hold ourselves accountable, and let's...
It's very dangerous.
It's terrifying. We need accountability, I think.
Yeah, for sure. In your case, you've built an individual with a lot of band-aids. So
Yeah.
what happened is you had a weak foundation, for what it is, and
Yeah.
then on top of that, you've built these workarounds to navigate different situations. Um, and repairing that is very difficult. And the best way to do that is strip it back down to the foundation, strengthen the foundation, develop those skills, and then build up the person that you really want to be.
Yeah. And I think that's for me why I had this gut feeling of I need to just get out of Australia and go where none of that is.
Yeah.
And that was, the scariest and best thing. But yeah, so I think anyone listening to this, it's so important. If you're feeling stuck, sometimes it is the scariest thing to remove all support systems or remove all of these, band-aids and just get to the core of it, because that's how
100%.
you got to get to the meat of it, don't you?
Yeah. I mean, I got to tell you, though, there are people who tell me much easier said than done. It's easy for you as an addiction psychiatrist to tell me here to get rid of my mom and get rid of my boyfriend and get rid of my sister. I get it. I don't think that I'm sitting here preaching, not realizing that separating yourself from an environment that for whatever reason is toxic is easy. So I do want to acknowledge that I recognize it's challenging, but I also know it's therapeutic.
Yeah, exactly. And, I know for me, I've had more opportunity than, a lot of people and had that facility, and some people have it much worse off. But at the end of the day, if we strip it all back, if you're going to sit there and, try and analyze who has it worse or better or this or that, the only variable you can work with is what action can I take today to try and fix my situation? You can't wait for it to get better or for someone to save you. It just won't happen. So we need to, in the right way, learn that.
Absolutely. I think that's a really great note to wrap up. That today is the day, if you identify with the things we've talked about, to get out there and do the research, and there are resources, and get help. I do appreciate you joining us today. Feel free to reach out to us if you need any support, and we wish you much success. So thank you for listening, and we hope to see you on our next episode. Thank you for listening. Please follow us or subscribe wherever you get your podcasts. Please follow us at Mindful Care and at TikTok Psychiatrist for more, and don't forget to rate and review.